So, let's start with an overview of haematological tests. These are essentially laboratory analyses performed on blood samples, blood proteins, and organs involved in blood production like the bone marrow. If you are enjoying this content, remember to like and subscribe so you can continue receiving similar content whenever we add more videos. Haematological tests are laboratory analyses conducted on blood samples, blood proteins, and organs involved in blood production, such as the bone marrow. These tests are essential for diagnosing and monitoring various medical conditions. Now let's talk about the purpose of these tests. They help in diagnosing conditions like anemia, which is characterized by a deficiency of red blood cells or hemoglobin, leading to fatigue and weakness. They also help in detecting infections by measuring white blood cell counts and other markers. Additionally, they are crucial for diagnosing haemophilia, a genetic disorder that affects the blood's ability to clot, leading to excessive bleeding. Blood-clotting disorders, which can cause either excessive bleeding or clot formation, are also identified through these tests. And of course, leukemia, a type of cancer that affects the blood and bone marrow, characterized by the overproduction of abnormal white blood cells, can be diagnosed with these tests. Moving on to the types of haematological tests, there are several different kinds used to diagnose and monitor various conditions. Each test provides specific information that can help in the diagnosis and treatment of blood-related disorders. White blood cell counts, both total and differential, measure the total number of white blood cells and the percentage of different types of white blood cells. This test is crucial for diagnosing infections, immune system disorders, and blood cancers. Platelet counts measure the number of platelets in the blood, which are essential for blood clotting. Abnormal counts can indicate bleeding disorders or bone marrow problems. The red blood cell count measures the number of red blood cells in a given volume of blood. This test is important for diagnosing anemia and other conditions affecting red blood cell production. Haemoglobin estimation. It measures the concentration of hemoglobin in the blood. This test provides essential information about the oxygen carrying capacity of the blood. Erythrocyte sedimentation rate, or ESR. This test measures how quickly red blood cells settle at the bottom of a test tube over the course of an hour. An elevated ESR can be an indicator of inflammation or infection. Osmotic fragility and sickling tests. The osmotic fragility test assesses the stability of red blood cells in varying concentrations of saline solution to diagnose conditions like hereditary spherocytosis. The sickling test identifies sickle cell anemia by testing the blood for the presence of sickle-shaped red blood cells under low oxygen conditions. Coagulation and clotting time evaluates the blood's ability to clot and measures how long it takes for clot formation. It's used to diagnose bleeding disorders like haemophilia and monitor anticoagulant therapy. Manual cell counting is a traditional laboratory technique for determining the number of specific cells in a blood sample using a haemocytometer. A haemocytometer is a specialized microscope slide with a grid for counting cells manually. This method requires manual dilutions of blood samples using calibrated pipettes and specific diluents. The basic principle is similar for counting different cell types, such as white blood cells, red blood cells, and platelets, but with variations in dilution ratios and the areas of the grid counted. Key differences include the dilution ratios, which vary based on the cell type being counted, specific diluting fluids used to either preserve or lease certain cells, and different areas of the haemocytometer grid used for different cell types. Haemocytometer structure includes several key components. First, there are the raised surfaces, two elevated platforms where the grid is etched for cell counting. The counting grid is separated by an H-shaped moat and consists of 9 large squares, each measuring 1 by 1 millimeter. Each square has a volume of 0.9 cubic millimeters, allowing for the calculation of cell concentration in a sample. Cell counting using a haemocytometer involves counting cells under a microscope, and the outcome is expressed as the number of cells per cubic millimeter. To convert this count to cells per liter, which is a standard unit in clinical settings, you multiply the count by 1 million. The depth of the haemocytometer chamber, typically 0.1 millimeters, is factored into calculations to ensure accurate cell concentration measurements. For a white blood cell count using a haemocytometer, the procedure starts with sample preparation. Whole blood is diluted using ethylenidiamine tetraacetic acid, or EDTA, which serves as an anticoagulant and lyses red blood cells to prevent interference in the white blood cell count. A common dilution factor is 1 to 20, meaning 1 part blood to 19 parts diluent, resulting in a total dilution factor of 20. Next, the haemocytometer is filled with the diluted blood sample. Under a microscope, white blood cells are counted in the 4 large corner squares, each measuring 4 square millimeters, labeled as W on the grid. The total count is used to calculate the concentration of white blood cells in the original blood sample.